The crisis facing Colorado hospitals deepens. Hospital beds in the state now running thinner than ever.
Data from the state shows a pandemic high, 93% of ICU beds occupied tonight. That just leaves 123 ICU beds for the whole state available. Acute care beds also running low, just 811 of those available.
But as Denver 7 CB Cotton explains, it's not just COVID patients filling up hospital beds.
Colorado's hospitals are becoming more full by the day.
It's really hard now, and we're starting to get to the point where when there's no room upstairs, they start having to board in the emergency department.
And physicians like Camilla Sasson are worried for what's to come.
I'm a little worried, I'll be honest, for the winter.
On Thursday, Colorado's top health officials announced that 90% of the state's ICU beds are in use. That's the highest share of beds being used in 11 months. And state health leaders say the hospitalization rates are up to 20 times higher among the unvaccinated. Sasson, who works at a Denver-based hospital, says in addition to beds being filled with COVID-19 patients, Coloradans suffering other respiratory illnesses are being admitted too.
People were delaying care. That means that they're oftentimes maybe a little bit behind on their diabetic meds or their high blood pressure meds. And so what you start to see is this cascading effect of people who start to just get sicker because they haven't been doing the care that we normally can do.
But a glimmer of hope to alleviate some capacity issues with the promise of booster shots.
So you're going to see a major push from us on, of course, boosters, on first and second doses, and on 5 to 17-year-olds.
Right now, the Pfizer booster is already being administered for those 65 and older and the immunocompromised. And just today, the CDC gave its final approval for Moderna and Johnson & Johnson vaccine boosters.
So again, this is an important reminder of the importance of booster doses to protect individuals who are at higher risk of severe disease, especially hospitalization or death.
And the state says it's already planning a major rollout to start administering vaccines to kids ages 5 to 11.
We are working very carefully with our local public health partners, our pediatricians, our healthcare systems to ensure that they are aware that the vaccine is coming, that they are ready to begin scheduling.
Sasson says it's a game plan that she hopes will help her and her colleagues.
It's going to be a long, long winter.
CB Cotton, Denver 7.